Welcome and thanks for joining us on the Flourishing Life podcast, where we will be discussing what we see on the daily. We're Jackie and Tad from Flourish Medical and Wellness in Savage, Minnesota, where listening to our patients is the priority. Our foundational medicine clinic bridges the gap between traditional and functional medicine. We are pattern recognition specialists that focus on individualized patient care and health optimization. With a combined 30 years of medical experience, our goal is to provide insights that will help you take control of your health. Be sure to follow us on Instagram at Flourish Medical Wellness and on our website, flourishmedicalwellness.com, to stay up to date with what's happening at the clinic. The following content is the opinion of Jackie and Tad Tewes and is not intended to diagnose or treat any medical conditions. Please be sure to speak to your healthcare provider for your unique needs. Hello, everyone. Welcome back to the Flourishing Life podcast with Tad and Jackie here from Flourish Medical and Wellness. We're listening to you. Our patients is our priority, and practicing a team approach to foundational wellness for long-term healing is what we are about. So today we are continuing our myths series. And today we're diving in specifically to myths and misconceptions and what to watch out for when it comes to lab testing and interpretation. So we have actually probably shared some of this here and there in some of the podcasts that we've done. But Tad, will you just kind of start off with explaining to us what a reference range or a normal range is on standard blood tests that we will typically get, whether it's in the traditional or kind of more of that functional space?
Absolutely. So when we get labs, we really have to go back to what are we trying to accomplish when we order lab work or when we order blood work? And that is to figure out what's going on the inside of the body. You know, what are those objective markers that we can look at of how a person's body is functioning? And then what are we actually comparing those values to? And that's where a reference range or reference interval is typically that range over on the right side of the page. Almost any lab that you get labs drawn at will have it there. And that compares a man or a woman to 95% of adult men or women, if it's an adult, who are drawn for that test. And that's a statistical analysis. So when we think of that big bell curve, we're taking huge amounts of data. We're removing 2.5% of the highest values and the lowest values to give us that 95% confidence interval. And that's really what we're getting with a reference range, comparing to both healthy and unhealthy individuals. So having that population comparison. Whereas when we're looking at an optimal range, we're really keying in on that person's age and gender and saying, okay, for a 40-year-old female, what is optimal for health, wellness, and longevity? Or for a 50-year-old male, what should these hormones look like? Or what should how the body manages blood sugars look like? And that's a way that we can be much more accurate and also have more purpose with how we're using those numbers.
Okay, so recap, kind of simplify it a little bit. What you're saying is that range is telling us where everyone tested, where 95% of those people fall, kind of in that middle range, healthy or not. They're not excluding unhealthy people. Is that correct?
Correct.
And so do those ranges change based on the population changes?
Absolutely. And that's something that we've seen ranges change over time in America. What we tend to see is on that reference interval, the range itself changes to accommodate for a less healthy population. Because again, we're just comparing to the population there. It's not a health-oriented or a wellness-oriented measure.
Yeah, so I've seen specifically blood glucose, like a glucose level on that CMP or BMP, where it'll note there on the lab paper when a reference interval has changed. So it'll say, no, reference interval has changed, and then it'll give you the old one, the new one, and what that looks like. And so most recently, what we're seeing is there's a new normal blood sugar range that is higher than what it had been. And again, that doesn't mean that it's good to have higher blood sugars or that that's healthy. It just means that more people who are tested have higher blood sugars.
And that's where I think interpretation and understanding what that range is, it's just boiling down big data is what it comes down to, is we're really looking at massive numbers of people tested for that particular test and saying, okay, where do most of these people fall?
I think the hard part with that is that overall in the United States, the people that we're testing against, like our health has been on a constant decline. And so really we're just comparing ourselves to other sick people for the most part. I mean, the chronic disease rates, the obesity rates, like they're so high, like over half of the population. And so now we're comparing these individuals to a half of a population that's already really sick. So how does that tell us anything? Question for you, I'm curious, do you recall, like in school, in medical school, were you trained on what those levels were, those reference ranges were actually telling you, or what that looked at?
No, looking back, that's definitely a gap in training. And you can see that actually when you look at reference intervals from multiple different labs. Like if we look at Alina to Fairview to LabCorp to Quest, those reference intervals for the same test will be slightly different. And it's because that reference interval is lab specific and that lab is boiling down massive amounts of data. They're going to be close, but they're not the same.
So basically, key takeaway, if you get your labs back and you fall in the range that's on the paper or that sometimes we refer to as normal, that doesn't necessarily exclude disease or mean that everything's fine.
Correct. And what we can look at, if we look at blood sugars in this country, because we're turning into the United States of prediabetes, is what's happening. When somebody has what's considered a normal hemoglobin A1C, or that average blood sugar over 90 days, 5.7 up to 6.4 is going to be where prediabetes lands. Let's say somebody comes in at 5.6, right below that prediabetes cutoff. That person still has insulin resistance. That process has started. It is just not so profound to where we categorize it as prediabetes. But no question, that person is not managing blood sugars as efficiently as when they were healthier.
Yeah. I think a good kind of question for listeners who maybe don't come to Flourish and or they're not being explained that, is to ask your provider, what does me falling in this normal range, what does that mean? Who is that comparing me to? And hopefully they know how to give that answer and how to guide and direct from there. But I think, and I'm guilty of this, just the days of looking at a number on a page and saying, oh, you're normal or you're not. So if you're in the range, you're fine, nothing is going on. I hope we're kind of seeing an end to that because there's so much more to the story. And so one of the things that we really do here and emphasize is having labs and those numbers being a part of the puzzle. It's really just a part though. And the other part of that puzzle is that we have to really look at how do we assess and look at their symptoms with their labs and make sense of the whole puzzle versus just taking individual pieces of that. So we speak to that a little bit?
Absolutely. And that's why that primary consultation or initial consultation is so critical, with understanding what that person has seen over and over again for months or years, and also trends. What changes has that person seen with regard to energy or recovery from workouts or mental health, stress management, all of those things, everything that goes into quality of life. And the other thing is when we're looking at labs, like you alluded to, it's not just a number on the page. It really takes a provider to say, okay, how does this lab result taken at this point in time give us clues about physiologic function? If we draw kidney markers or a metabolic panel right after somebody comes in from a CrossFit workout and maybe they didn't get as much water as they should have, their kidney markers aren't going to look great. They're a little bit dehydrated.
Muscle breakdown.
It can be. And if we would draw those same labs 2 hours later after they had rested, gotten hydrated, had some electrolytes, those labs could look very different. And so it's not necessarily a change in how their body is functioning, but timing of that lab draw and being able to take that into context is huge too.
Yeah, so context meaning we have to understand the symptoms surrounding the environment surrounding the activities surrounding the labs. It's really not just as simple as we're going to draw your blood and this means it's good or it's not.
Correct. And even time of day, because we know that certain markers can shift drastically throughout the time of day that they're drawn.
Yeah. And for me, I wasn't trained that way. It was really just, here's your numbers, it's good or it's not good. And then if it's not good, here's what we do. If it's in the range, then they're fine. But really what we do here, and I think one of the reasons our patients tend to see changes in their overall health and how they're feeling is because we look at the symptoms and the numbers and how those go together, right? So say there's some gut markers that we can look at on a blood panel, a pretty simple blood panel. But if they have no gut symptoms, then it's probably not as big of a deal for them, even if it's out of that optimal range. But if they have some gut markers that are right on the border of that optimal range, and they have constipation or diarrhea or heartburn or bloating, okay, we need to focus on this. And so it goes both ways, where even in that optimal range, sometimes people fall a little bit different, and that's okay for them. But if they're having symptoms of that, we absolutely need to dive a little bit deeper.
Absolutely.
Okay, so part of what we wanted to do for you guys today and kind of dive into is looking at some of that. There are so many tests in the traditional world as well as in kind of that functional medicine world, and understanding, how do I know if it's a good test? How do I know if there's benefit to it? A lot of times in the functional world, those tests can be more expensive. And so is it worth the bang for my buck to really, get some of this testing done?
Yeah. And that's a great question, because more is not always more, unless you're talking about how much money a person is spending on diagnostic testing.
Yeah.
So really layering testing, and what I mean by that is what we do here at Flourish, where we get a pretty comprehensive test panel, but it doesn't have all of the advanced testing or bells and whistles, because that's not necessary for everyone in the population, and it just drives up the cost. So if we get those things that are pertinent to everyone, and then we can build out on that, that's what makes the most sense, just from a responsibility standpoint.
Yeah. Okay, so let's just go through a couple real quick on a CBC. So CBC with differential. Give me top 3 things you can interpret from that simple CBC, which is really probably like $10,
Yeah,
right?
it's not an expensive test.
Especially when we're not using insurance. So what are those things that you can just pick up, just quick, from a CBC?
Yeah, so a CBC is going to be the main components within blood, meaning red blood cells, white blood cells, and platelets. And so we're looking at immune function. Is that person producing red blood cells appropriately, whether they be too high or too low? And that can lead to some potential digging into about disease states, things like sleep apnea, and then also platelets and platelet production, which is the major clotting component in blood. With the differential, we get the 5 different types of white blood cells there that we can track, and that lets us know what the immune system is doing at that point in time.
Okay, so simplify that even more. So I heard you say sleep apnea, immune function, clotting issues.
Yep.
Right? Any other big ones that you would take away from there? Just high level?
It can also give us an idea of if the body has a high toxin load. If we start seeing the immune system reacting in a way that is atypical or abnormal, that can be due to toxins, whether it be things like pesticides, heavy metals, parasites,
Mold.
Mold, good call.
Okay. And then how about the CMP? So CMP, Complete Metabolic Panel, again, a very common test that I would say most people have probably had run, whether or not they know it. Again, high level, what are 3 or 4 things that we can get from that test specifically?
Yeah. One thing, if we get that test fasting, then we get a fasting glucose or a fasting blood sugar, which is a really important marker. We're also going to be able to look at kidney function, liver function, and then how the body manages electrolytes like sodium, potassium, and calcium.
How would that relate with some symptoms that patients may be having, just to kind of connect the dots for them? Because kidney, what does that mean?
Yeah. When we look at kidney function, so what we're looking at is those kidneys, which produce urine that we get rid of from the body. Are the kidneys getting good blood flow? And then are the kidneys filtering efficiently, which is an incredibly important process for us, not only in terms of detoxing, but also for life in general. And then the liver, that's our main metabolizer in the body. So whether it is medications, alcohol, supplements, those all need to be broken down by the liver. And those liver enzymes, specifically AST and ALT, those are going to show us how hard the liver is needing to work to detoxify and metabolize compounds in the body. And then when we look at electrolytes, that gives us a look into adrenal function and if there's some cortisol burden there.
Okay, so high level detox pathways, some adrenal cortisol dysfunction or burden. Obviously, again, kidney function, gut. I think gut is another one that you didn't really touch on. We can kind of see how that's absorbing or not absorbing, or even nutrient level with looking at protein intake, and albumin can really show us, if it's high, we probably aren't getting enough water, we're not hydrating well enough, Whereas if it's really low, that could be a sign of inflammation.
Absolutely. And when we look at those markers, that's a really good point, is for gut health, total protein, albumin, globulin, those are all things that let us see what is the body doing. And when we relate that to the type of diet a person is eating, how many grams of protein they're taking in a day, that gives us an idea of absorption and potentially inflammation in the GI tract as well.
A simple one, it's not always, hey, we have to be on all these supplements and we have to be on all these peptides and all this stuff. It's just, where's our baseline? Let's make some simple lifestyle changes first. And I mean, it's pretty common that we see changes in those numbers when we even make some simple changes.
Absolutely. All right, pro tip for everybody. A CBC with differential and a CMP, a comprehensive metabolic panel. These are cheap tests that provide a ton of information. For under $50 to $100, be able to get a boatload of information on how the body's functioning.
And I didn't know that. I mean, that's not how I was trained to look at those. I was trained to look at the blood sugar, kidney function, very high level, liver enzymes if they were on statin to make sure we weren't bogging their liver down. So much more. And again, most of you probably have that already and had that tested.
Yeah, a very standard test. Jackie, will you tell us a little bit about a lipid or cholesterol panel?
Yeah, so I think we did maybe speak to this a little bit more in another podcast on Heart Health Month. I don't remember what that was, but key takeaways, that something that is different than what I was taught and during school, and I think everyone needs to understand, is a few things. Number one, if we are using a lipid panel as an independent risk factor, so meaning we're just basing your cardiac risk on a cholesterol panel, HDL, LDL, triglycerides, total cholesterol, which is in that lipid panel. If we're basing your cardiac risk on that alone, the LDL would have to be over 200 for us to see significant concern or risk and the correlation between plaque buildup in the arteries and the numbers on the paper. So over 200. Many people are having this cholesterol checked, and if it's over 100 of the LDL, for sure over 130, they're being recommended to put on a statin. And so there's so much more to understanding cardiac risk, and it should never be used as an individual risk factor or driver of when to start a statin. So things like a CT calcium score, ApoLipo-B, lipoprotein(a), there are so many other ways that we need to be looking at this. So again, if you're out there, your provider is pushing a statin on you because of simply your LDL or your total cholesterol overall, red flag. Ask for more testing. Ask for other, like a CT calcium score or further cardiac testing to know if that's absolutely necessary. And one of the big reasons for that is that if we're put on a statin and we're lowering our cholesterol is important for the body. It is the foundation and where hormones are made from. So if we're lowering cholesterol, we're no longer able to make adequate hormone levels, which then has a huge downstream effect. Asking more questions, knowing it's not a great independent risk factor for actually assessing cardiac risk. The other thing that we see, I think this is some newer research as well, that as we age, those with the lowest levels of LDL actually had higher all-cause death rates. The lowest levels of LDL in the cholesterol panel were associated with higher all-cause death. Okay, so why? Well, part of the reason is that LDL is a helper molecule. It is a transport molecule. It helps transport out bad things in the body, different types of bacteria, lipopolysaccharides, things with these biofilms that your body can't always break down. And so it's actually trying to protect us. And so when we have it, we're lowering that and our bodies aren't able to use that protective mechanism, we see higher rates of all-cause death. Other things can happen. The other thing is that we can see LDL go up with things like thyroid dysfunction, insulin resistance, high blood sugar, even some parasite stuff going on or infection. And so we can't just automatically say your LDL is high, you need a statin without any other testing or digging.
Absolutely. And that's when we look at LDL or low density lipoprotein, for decades and decades, it was demonized as this horrible heart disease causing molecule. And when we look at LDL and actually dig into the research, there are significant immune benefits with LDL. It plays a role in our immune system, and also cholesterol in general. It's a building material in the body. So when we look at cell membranes and we look at hormones, those are going to be built from cholesterol. And these are things where understanding the function of cholesterol is really important as well.
Yeah, I kind of go back to that whole, if God made us with something, it isn't necessarily bad. It probably has a role. It's supposed to be there for some reason. But too much of a good thing is never a good thing either. So there is a balance there. But just be careful not to just be kind of thrown on the bandwagon of, oh, this number is high. You need to be on cholesterol medicine.
Yeah, and you made a good point outlining that as an independent risk factor. LDL is not a great marker for assessing cardiovascular disease, but when we put it into the context of, is there pre-existing plaque formation within the coronary arteries that feed the heart? Is there insulin resistance? Is there a systemic inflammation or full body inflammation problem? Then we're able to look at LDL as more of a risk factor instead of just in a vacuum.
Okay, another test that we can look at that's pretty simple to run on a blood panel is a GGT. Can you tell us about that a little bit?
Sure. GGT traditionally was more of a liver or biliary disease marker. So gallbladder inflammation, gallstones, issues with the liver. We can look at GGT, which stands for gamma glutamyl transferase. The other thing that we're seeing now as more research has been done is this is actually a good glutathione marker. And glutathione is our master detoxing compound within the body. Glutathione, it helps our body get rid of so many bad things that we need to rid for optimal physiologic function. So when we start seeing GGT go up, what it indicates, or can indicate, increased oxidative stress or increased inflammation in that area and an increased need for glutathione or NAD.
Awesome. So that's a really great way, because we don't typically have a great test for that. So it's not obviously a direct measure of NAD or a direct measure of glutathione, but it can show us that the body's having a hard time reducing and managing that oxidative stress, and that those things could be helpful.
Yeah, and when we use GGT in this way, it needs to be taken into account with symptoms that a person is experiencing, as well as other potentially inflammatory markers or detox markers.
Yeah, for sure. So the other important thing to consider when we're talking about kind of this wider array of different types of functional medicine testing, like hair test, micronutrient test, urine tests, is looking at a couple things. So reliability, validity, sensitivity, specificity. So just to make this kind of super easy to understand. So a reliable test means that you can take the same sample, repeat the test over and over, and get the same results. So if you take the sample and you repeat it and you get different results, that's not reliable. Okay, so we have to make sure they're reliable. Validity is referring to, is the test actually measuring what it says it's measuring? Is it valid? So the other piece that comes into validity is when we look at that sensitivity and specificity. And so this is telling us where you could have maybe higher false positives or higher false negatives. So again, just making sure it's valid, it's testing what it tells us it's testing, and that we're not having higher or false positives or high false negative rates.
Absolutely. And that becomes so important when we're having decision making based off of those lab values.
Yeah. So then we also look at, is this scientifically sound? Like, is there literature and data to support the use of this test? Has it been studied to your point, then kind of provide treatment plans and outcomes that are going to benefit the patient? So is it scientifically sound in the literature? Are those reference ranges valid? Like, do we have a good way to measure that? That's another thing that we need to take into consideration when we're looking at foundational testing. And then the final thing is looking at what's the value? What's the bang for your buck there? How much is that going to move the needle, and how much information are we going to get from that? Okay, so Tad, tell me a little bit about an organic acid urine test.
This test is pretty accurate and reliable. It unfortunately it's a test that is not widely scientifically accepted. There's not a ton of research backing the use and utility of organic acid urine testing, and they can be difficult to interpret. So from a standard test standpoint delivered in mass to many, many people, it definitely is not one of the better tests out there for providing clinical decision making.
Yeah, and I think they can be pretty expensive too. So probably better ways, other ways you can get some of that information.
Jackie, will you tell us a little bit about hair and tissue analysis testing?
Yeah, so hair testing can be a little bit tricky because the reliability really isn't great. Meaning, again, if we take the same sample and test it repeatedly, we're not always getting the same outcomes, the same measurements. That right there makes it a less valuable test. We also see pretty significant variations across labs when we're looking at hair testing, and there's not a lot of great clinical utility in this or high value. One thing that it can be really good for is more population-based testing, but it's not as great for individual based testing to get us, information that we then need to take action on. So for example, when I was kind of diving into this, just an easy example to understand this is that, a hair test came back low in zinc, but when we administered zinc, we weren't actually seeing those levels go up
in the hair.
Okay, so then there's also a micronutrient urine test. So again, we're testing urine versus blood. This one can be difficult as well. What they have found is that, say we have a blood sample comparing to the urine sample. And when we had high or normal levels of B12, the urine test actually showed low levels of B12. And so it can be a little bit tricky. There are other interfering factors like kidney status, filtration status, like what other things are interfering with when we're getting to the end result of this urine. And so what we saw, again, comparing serum to urine testing, they weren't super accurate.
When we look at urine testing, a big thing that we do is we look at, okay, how are the kidneys involved in this? How does kidney function play a role into this? And also those substances that need to be metabolized through the kidneys or broken down through the kidney. All of that goes into interpretation of urine versus blood levels, especially for substances that are primarily passed through the kidneys.
Yeah. The other thing too we should note is that, if you're getting a 24-hour collection, those can be more accurate. That means you have to collect every single drop of urine for 24 hours,
Correct.
Which is not feasible for most people. All right, we are almost done. We have 3 tests left to chat through. A couple of these we do here at the clinic. One of them we don't do a lot of because we just don't find a ton of need for it. But let's start off with that Dutch testing. What is a Dutch test?
Yeah, so a Dutch test is going to be a dried urine test. And what we're looking at is we're looking for hormones and what are called hormone metabolites. So trying to get a peek at what are hormone levels and how is the body metabolizing or breaking those down? And so it does give an added layer of information on top of blood hormone levels. Some of the cons to a Dutch test are, does it actually provide significant information which changes care or adds to care? In some people it can, in many people it does not. So the question becomes, for more expensive tests like a Dutch test, is it of value? And when we look at hormones specifically, what we tend to see is the blood levels are going to be that first layer and a very reliable layer of what's circulating within that person's body. And then if we need to dig deeper, or if there's very atypical symptoms or something is not adding up, then we can use a Dutch test on top of that if needed. But from a clinical utility standpoint, Dutch testing can lead to some overtreatment. It can lead to some misdiagnosis as well at times. So it's not a perfect test.
Yeah. So really, when we're looking at the metabolism of hormones, what it's not telling us is here are the levels that we know to initiate treatment or to, apply like hormone therapy treatment. And there's really, from my understanding, not a lot of studies and literature out there that show, hey, if their Dutch test shows this level, they need this much estrogen. Whereas that is typically how the literature shows us, and we're looking at how to treat and use HRT in serum blood tests.
Correct. Yeah, from a clinical utility standpoint, or how is this going to direct treatment for this individual, the serum levels tend to be much more accurate than a Dutch test, especially when we're looking at outcome-based studies.
Yeah, so may be helpful and necessary in those complex cases, like you mentioned, where things just aren't going like we would expect. There could absolutely be some kind of breakdown issues there, but for the most part, not necessarily something we do a lot of, because we tend to be able to use the cheaper serum levels that are going to give us really great information, and then just basing our treatment plans and adjustments on our patient's symptoms, right? Because again, your body's going to tell us what's going on there.
All right, we're trying to rein it in. Jackie, will you tell us about GI map testing?
I would love to tell you about GI map testing. So
I wouldn't.
GI map testing is something that we do here at Flourish for some patients if it's necessary. So this is a stool test. So you're collecting your poop and they are looking at it under the microscope, specifically testing for the DNA of different types of bacteria, parasites, viruses, your commensal healthy, good bacteria. So they're actually looking for the DNA levels there, or the DNA presence there. And then they're also counting that. So they're also able to give us a quantitative, so a value as to how much of this is present, and is that good or bad.
To follow up on that, with all the different bacterial species that are present within a person's GI microbiome, are we supposed to have specific amounts?
Yeah, so that's a great question, and that is part of when we look at the validity and the reliability of this test. Part of the cons that we can potentially see is what is the actual normal range and the therapeutic range. So there's some debate on that. And so yes, there are certain amounts of bacteria and types of bacteria that we need in our gut, and there are also certain types of bacteria that we see in the lower GI tract that have moved up to the upper GI tract that should not be there. So in that way, it's great to say, hey, like we should not have this much streptococcus in our upper, in our guts, but it's there and it shouldn't be there. So why is that happening? So that is one of the things. Is there an acceptable amount that's optimal for that person? Can be a little bit gray. In general, where I believe a GI map can be very helpful is when they've done all the other things, like they've seen their GI doc, they've had an endoscopy, maybe they've had a colonoscopy, they're still having obvious gut symptoms. It is a very good test in those situations when we've kind of, ruled everything out and we still are having problems. Then we need to know what is in there.
The GI map testing as being the best way to really target an individualized therapy for that microbiome?
Yes, especially when they've done all the other things. So I don't think it should ever be your first test to look at, simply because we can also see some over-treatment there and kind of picking at things, especially if they're not having a lot of symptoms, right? Like I would never just be like, oh, we should get a GI map on everyone. Because if you're not having symptoms, that might be fine for you, even if it comes back a little bit high or abnormal on that GI map result. So again, it's variable, but if you're having symptoms, you've had other testing, it is a very good tool to use when we haven't really found any other good answers.
You made a great point right there that ordering labs in the right setting is so key to prevent overtreatment, to prevent treating a problem that doesn't actually exist, just because that's the way that person's body functions physiologically.
So again, validity of this test is very good because they're looking at the actual DNA structure. And so we know that it's there. We know how much is there. It's just really that reliability of, hey, does this mean that there's a problem or not? And being careful of over treating when it's not necessary, which is why I think if you're using that as, hey, you've done all the other things, what else is going on? It's a very, very useful tool. Tad really loves poop tests, don't you?
They're special.
The good thing is you don't have to collect the poop test in the clinic. You get to do that at home. Okay, the last test is probably one of my favorite. Why it's one of my favorite is that there's really no other great way for us to test for these things. And again, when we have these super complex cases, our kids, are adults with like multiple symptoms that no one can find an answer for. This is where it's at.
Yeah.
And time again, we implement protocols, treatment plans specific for what we're seeing on the test, and life changes. Like their symptoms are gone. So I really like this one.
Yeah. All right. Will you tell us in detail about a total toxin panel, and then also when you order these, specific times or specific instances where you find this most valuable?
Okay. So total toxin panel, it is a urine test. So it is checking your urine for, again, these things that you're peeing out. So looking at your urine under a microscope for different types of mycotoxins, which are going to show us if there are high mold levels, heavy metals. And then we're also looking for environmental toxins, which will include things like pesticides, herbicides, VOCs, phthalates, parabens, just the things that we're breathing and drinking every day, all day. And so that's what it's testing for. When do I use this? Sometimes I will use this if there is some high levels on that CBC with those white blood cell markers. They look really out of whack, but the person hasn't been sick recently. Something is going on. Something's driving the body to make these cleanup cells that are trying to get rid of something. So what is that? That's a really good time to take a deeper look and look at your toxin panel. I had this just yesterday, I think, 11-year-old girl. Parents just felt like something wasn't right. They weren't really sure. Very generalized symptoms, headaches, stomach aches, and would just get sick a lot. Like just always seemed like she was fighting something. So we did some blood work. They actually did go ahead and do the toxin test because her lymphocytes were 10, 15 points over what they ideally should be. So that's a pretty significant level. The other thing that we saw in her was that she also has Hashimoto's. And so a lot of times when we see this kind of overactivation of the immune system, I want to know what's driving that. What else is causing stress and strain on the immune system and kind of this over attack response? So that's another really good time to use this, is if you have some autoimmune conditions. Is there something we're missing? Is this a piece that we need to address as well to try and help take some of the burden off the immune system?
Absolutely. And that's where the immune system in general, it is a complex, beautiful system designed to protect us. But if it's exposed to certain compounds or exposed to things that are bad for it, toxins for longer periods of time, we can see that reaction become hyperreactive or increase in the immune system, like you had talked about with Hashimoto's, where we make thyroid antibodies for those numbers to skyrocket. And it's because the immune system is very hyperreactive or doing much more than it should be doing.
Yeah. Okay, so the total toxin panel is being measured via what's called LCMS-MS, which is liquid chromatography mass spectrometry.
Oh, nailed it.
Just LCMS-MS. What that means is it's a really good test. The other really cool thing is that Vibrant, who we do this lab through, again, they use LCMS-MS. They are a CLIA certified lab, meaning they follow all the standards, all the guidelines. They're tested, they're accredited. So very reliable lab testing, specifically with where we do this panel from. This test is really good at showing us what is high, where it's potentially coming from, and what symptoms that's been known to cause or how it is known to affect the body. So it's really great because it tells me, what do we need to do to get rid of it? How do we stop the exposure that's happening? And then is this the answer to some of the symptoms that we've been seeing and experiencing? And so that's really great. The one thing it doesn't do is it doesn't tell me when was the exposure, how long has it been there? Like, for example, mold. Are you currently living in mold, or is this a mold exposure from childhood or from years ago? I have seen that. I think she was like a 18 or 19-year-old girl. She was super high in like aflatoxins and different types of molds that we see specifically in different types of cereals. And so we were talking, she's like, I haven't eaten cereal for years. Like, I don't eat cereal. Where is this coming from? And I was like, well, have you ever, like, were you ever a cereal eater? And her dad used to work for one of the big, like, either Post or Kellogg or something. And so when she was a little kid, he would bring home all the cereals. So that was very eye-opening for me, just learning, hey, this could be from a childhood exposure that your body hasn't completely been able to get rid of. So it doesn't tell us timing of that, but it does provide some other really good information to really help us narrow in and create a specific detox plan for that patient. The other really cool thing about that I love is that when you have those hard cases where they've been to all of the places and they don't have any answers, and then we get this toxin test back and it lines up with the symptoms that they're having, that's one of my favorite.
Absolutely, especially with things like mold or heavy metals, where typically it wasn't going to be tested for at another facility. And then we can put together individualized protocols to help the body detox from those specific substances.
Yep. All right, so that's a wrap, I think, for the testing piece, functional testing, kind of our traditional testing. We will have some bonus episodes for you guys. I'm really excited about these. So our very own Patrice, who I call our metabolic specialist, is going to be joining us on a podcast episode here in November. And then also a dietitian, nutritionist will be joining us as well to give us some good tips going into the holidays. And then, of course, we'll have our December episode.
Yes, next month we're going to talk about eating habits, intermittent fasting, continuous glucose monitors or CGMs, and then also holiday eating, tips, tricks, and pitfalls.
Tad loves this topic.
I like to eat.
So thank you for joining us. Please share this episode if you found it helpful. And as always, if you have questions, comments, feedback, we would love to hear it. Until next time.
Buenos dias.
Thanks for listening in to the Flourishing Life podcast. You can watch this full video version of this podcast inside the Spotify app or on our YouTube channel. If you like this episode, please rate, review, and subscribe on your favorite podcast app. And be sure to share this episode with a friend and follow us on socials at Flourish Medical Wellness and on our website at flourishmedicalwellness.com. The information on this podcast is for educational purposes only and is not intended to replace medical advice or to be a substitute for professional medical diagnosis or treatment.